Professor Lawrence Ramsey has analysed studies around the world involving thousands of people and has come to the same conclusion.
The facts need to be faced. There's no point in persevering and wasting resources on an intervention that's not going to make much difference.
He says changes in diet do not reduce cholesterol levels enough to save lives.
We're still getting new guidelines coming out, still saying that you will reduce cholesterol by 10, 15, 20%, which is simply not true.
But the government has been persuaded that the time has come to invest in prevention, and leading food firms have joined the campaign. This summer's white paper, Health of the Nation, said the amount of saturated fat in the national diet should be cut by a third.
The message remains, and I'm sure will remain for a long time to come. Healthy eating is enjoyable. Healthy eating means eating less fat, especially saturated fat, and it means eating more fiber-rich, starchy foods, which we see all around us here.
What we do need to do is, I think, look at different diets, start again, look at different dietary modifications to see whether we can get simple and effective changes which would have a larger effect in cholesterol.
It's taken years to persuade the government and industry to tackle heart disease, but during that time the science has moved on. It may be that today's advice has passed its sell-by date. Andrew Veach, ITN, in Berwick Street Market, Soho.
They're supposed to fight cholesterol, but they've been clashing among themselves. The margarine war started with firms lodging official complaints about each other's health claims. The result, both were today in trouble as advertising watchdogs ruled wording was misleading.
Companies overstated how much you could actually benefit from eating their product. They stated averages which weren't really an average. They stated consumption levels which are actually much higher than most ordinary men and women in the street would eat.
These foods that will keep your cholesterol levels low. By Manya Singh. Certain foods help you to keep your cholesterol levels in check and reduce your overall risk of heart disease, says nutritionist Anjali Mukherjee. Your chance of developing coronary artery disease is increased by high blood cholesterol levels. Preferable. In very rare instances, having very low levels of either bad cholesterol or total cholesterol has been linked to certain health issues. In certain instances, it is unclear whether a health issue is brought on by low cholesterol or the other way around. For instance, statin medication to lower cholesterol has not been proven to promote depression, even though persons with depressive episodes may well have low cholesterol levels. The advantages of lowering total and LDL cholesterol, however, have been thoroughly documented, particularly in people with heart disease or who are at high risk for developing heart disease or strokes. In one of her recent Instagram posts, nutritionist Anjali Mukherjee discusses foods that may be helpful in reducing your bad cholesterol levels. She writes, certain foods help you to keep your cholesterol levels in check and reduce your overall risk of heart disease. Food groups that can help lower your cholesterol levels according to the nutritionist. 1. Consume oils rich in MUFA, monosaturated fatty acids, such as till oil, mustard oil, olive oil, etc. 2. Increase your intake of fruits and vegetables to at least 4 to 5 servings a day. 3. Eating foods rich in soluble fiber such as isabgol, most leafy vegetables, oat bran and whole pulses helps to reduce total cholesterol. 4. You may also take vitamin E supplements as it prevents oxidation of LDL or bad cholesterol. Look at her post. Keep these foods in mind if you want to follow a cholesterol-friendly diet. Disclaimer. This content